name is Yarely Lopez.
And my name is TaNaya Dickerson.
As people self-isolate to stop the spread of COVID-19, increasing rates for depression and anxiety can be observed. While some people are thriving in quarantine, others, however, are finding it extremely difficult to stay motivated. Not to mention, as a result of a lack of socialization, it is easy for people to feel alone. With the rise in depression and anxiety due to fear, isolation, and a widespread trauma stemming from the pandemic, we are now more than ever in need of psychiatrists, people who promote mental health and well-being.
You may be wondering, what does a psychiatrist do? Psychiatrists specialize in preventing, diagnosing, and treating mental illness. They are medical doctors who evaluate and treat patients using techniques such as psychotherapy, psychoanalysis, and cognitive behavioral therapy, or medication. They are the only mental health professional who can prescribe medication that can be taken. In California, the entry salary for a psychiatrist is $345,952.
For most psychiatrists, it takes 12 years to become a practicing psychiatrist, with there being 6 critical steps in order to do so. The first begins with earning a bachelor's degree, perhaps in a psychology or pre-med major, and ends with passing the American Board of Psychiatry and Neurology certification examination. Not everyone can be a psychiatrist because there are certain skills and personal qualities that a psychiatrist must possess. These include interpersonal skills, communication skills, empathy and listening skills, as well as a passion for helping others.
Overall, in an ongoing survey conducted by Career Explorer, psychiatrists reported to be highly satisfied with their job, rating their career as a 3.8 out of 5. As psychiatrists, there are a variety of career paths that you can choose from, because no patient is going to be the same and every patient has a different diagnosis.
Typically, psychiatrists will work full-time. They often are on call to respond to emergencies, and this will of course vary depending on setting and area of practice, but for the most part, psychiatrists work with flexible work schedules.
The most difficult part about being a psychiatrist is that you have to deal with patients, and that can be stressful or it can be draining because you have to work with them and make sure that they're keeping up with their treatment. And so to be a psychiatrist, you need to have a great job separating your personal life and your professional life. Psychiatry still remains one of the most fulfilling and most promising careers.
We chose to research psychiatrists because we are both interested in the ways that mental health affects how we feel, think, and act as we go through life. We both prioritize our mental health, but we have also seen the ways in which neglecting your mental health can impact your overall well-being. I have a mom who suffers from depression and anxiety, and I saw her condition worsen during the pandemic. Fortunately, she is currently receiving help from both a psychiatrist and a therapist who have helped her remain stable. It is ultimately because of experience that we find it very important to shed light on mental health and the careers available, which is where we discovered that psychiatrists come in.
Psychiatrists are incredibly useful in the healthcare system as a whole. They work with other healthcare professionals to create plans on how a patient can be treated. They diagnose patients and they develop a treatment that can be followed with the main healthcare professional working on the patient. And they are trying to tend to the patient's needs to make sure that it's all a correct treatment.
We want to thank you for your time. We hope that you are staying safe and healthy.